we're interested in all varieties of cholesterol and triglyceride-related problems in children, many of which are genetic. The genetic ones tend to be rare, but not in cases of FH, for example. FH, or familial hypercholesterolemia, is usually associated with a high cholesterol level. That's pretty common, actually. It's 1 in 200 to 1 in 500 of the population. So you can do the math. Just divide the number of kids you got by 2 to 500, and you figure out, well, there are a lot of these kids around. On the other hand, the triglyceride problems are much more rare. This has been looked at in a large Scandinavian population where extreme levels of triglycerides. So these are levels over usually 2,000, 5,000, 10,000. These are less than 1% or 0.5%. But they invariably have problems with the way that the body processes triglycerides. So again, the difference is cholesterol and triglycerides are not the same. They're both lipids. Triglyceride is basically the form of energy that you get from eating fats. And the body tries to distribute this for use by the muscles. The excess is stored in the fat cells, or adipocytes. But when you get levels of triglycerides, usually over 1,000 to 2,000, then the immediate risk is for pancreatitis. So the pancreas that sits behind the stomach can be inflamed. These individuals will have severe abdominal pain, they'll have vomiting, and it can actually be lethal. So we've seen a number of kids recently who presented anywhere from 2 months to 6 months of age with extreme elevations of triglycerides, pancreatitis, extremely sick, and been able to diagnose them with a very rare disorder that has to do with the binding protein for lipoprotein lipase deficiency. That particular enzyme actually helps cleave the triglycerides so it gets into the cells as free fatty acids. But these are very rare conditions. Good news is that there are some emerging technologies that will allow either that gene to be replaced or that those triglycerides to sort of be effectively digested by the body. Right now, the best thing you can do for them is a pretty severe restriction in their fat intake. So whereas most of us have around 30%, 35% fat intake, for these children we actually reduce it to 10 or 15%. But when we do that, we have to be very cognizant of essential fatty acids and vitamins, because vitamins get absorbed through the fat. So we have to make sure in the developing child that we don't shortchange them on free fatty acids that are essential for health as well as for vitamin intake.